Have you had the misfortune of having a stroke or knowing someone who has? That's what we're going to talk about today on Senior and Living Today. We're going to talk about stroke awareness. So, if you are new here, welcome. And where have you been? And if you are returning, welcome back. Thanks for coming back. I wanted to talk about strokes today because an increasing amount of people are being stricken with having a stroke. And I think a lot of people don't know the signs, and people don't know what to do when they think that they are having a stroke or they know someone that they think is having a stroke. So I want to talk about that because someone I know recently had a stroke, and their response was not to respond. And that is the wrong approach. They had gone out to eat, they were out with friends, and all of a sudden they realized they could not move and they could not speak. And the other people at the table, the conversation was going, and they weren't noticing that she wasn't responding, she wasn't interacting. They were just talking amongst themselves, and no one noticed. So she said that for about 10 minutes, she found that she could not speak and she could not move. And everyone around her was oblivious to what was going on. We need to pay more attention to those around us. Even if we are having a conversation, while we're speaking, we need to be looking at other people. We need to be observant of what is going on around us. So when her ability to speak came back, she said nothing. She didn't want to cause attention to herself, didn't want to embarrass herself, and she figured, I can move now, I can talk now, and she said nothing. After they were done with their meal, they went and ran some other errands, then she went home. When she got home, she couldn't get it off her mind. Thank goodness for that. And she decided to reach out to her medical provider. And when she did, her provider was like, well, it's been more than 2 hours, which is the window that they like to be able to see you and give you a medication, treat you quickly after a stroke. And the physician, they did do a scan and did see that she did have a stroke, but it was too late for their the intervention they wanted to provide her with. A lot of times people don't have that second thought and call their physician, or people say things like, let me see how I feel in a little while. Let me take a nap and see how I feel later. Let me go to bed. Let me see how I feel in the morning when I wake up. That is the wrong approach. That is the wrong approach. If you feel like something is going on with you neurologically, you need to act immediately. You need to not drive yourself because you could become frozen, incapacitated again. Do you want to do that while you're driving your car? No. You want to call an ambulance and you want to get to the hospital. If you notice that you are having trouble speaking, if you are notice that you cannot smile, if you are noticing that you are having numbness and tingling and weakness and can't move parts of your body, those all require you to seek a professional. If you are with someone and you feel like something is going on with them neurologically, like they could be having a stroke, you offer them two options. If they say, they don't want to go to the hospital. You say, you're going. Are you going by car? Or are you going by ambulance? But we're going right now. Those are the only options they should have. And truly, an ambulance is the best route at that point because it is emergent that they see someone and get care and treatment right away. There is no better thing you can do as an individual when you think someone's having a stroke than to act fast. You need to be aware of the signs. If they're having trouble with speech, if they're having trouble with mobility, if they can't smile at you, if they can't talk to you, that's an emergency and you should not let that stand. And if you are a person and you feel like that is going on with you and you are by yourself, even if you can't speak, you can dial 911. And if you can't get any words out, they will still come. They will still come. So please don't waste time. Don't hope that everything will start functioning again normally. Call an emergency service right away. And while we're talking about that, I just want to say that so many people have strokes, so many people have instances where they are temporarily disabled. Let's say you have uh, a hip surgery, or you have a spinal surgery, or you have a stroke and it takes, a few weeks maybe for you to get your speech back or your mobility back. You need to think about what is in place for someone to come and take the best care of you if that's needed. I did have a person that I was caring for before, and I was just caring for her for the weekend. Her family was out of town. She was under 24-hour care, and her providers, her full time providers, were out of town. They called me in to take care of her, and her dog got sick. And I said to her, and she was in her 80s, and I said to her, "Who is your veterinarian?" And she didn't know the answer to that. That is a common thing. What happens is when someone calls you in to take care of a family member, what they do is they leave the number. Obviously, you know the number for 911, and they might leave a number to a next door neighbor, but and they often leave the number to their doctor. But other numbers you might need that are important to your client, the person that you're caring for, those numbers aren't left. So when I said to her, "Who is your veterinarian?" she could not tell me. So I had to call her family, who was in Las Vegas, and ask them so I could get the pet to the vet they normally see. Of course, I could have looked up one, Googled one, but that was not going to get the pet to the vet that they always see. That's kind of an important number. That same weekend, the client wanted to have her hair done. And I was like, "Who's your hairdresser?" And she said, "Susan." Well, that's not really helpful. I'm saying that to say she was able to speak, but she didn't know the answers. And so, as a caregiver, I tried to think of what is it that when I go to care for someone, what are some of the things I want to know about that client that would be helpful? And it might be things that the client does not remember. If you're a family member, you can provide that information. And I have created what I think is a good tool to have. I created the Living Legacy Planner. And in the Living Legacy Planner, one of the first things in here is temporary instructions for a caregiver. What makes this planner different from other planners? The other planners you find are either post life planners or they're day to day planners. I need to do this tomorrow, this the next day. This is a living legacy planner. This is a planner for while you're alive. It is for important information that someone coming in to care for you, you would want them to have. You would want them to know who is my neighbor, who is my hairdresser, who is my mechanic, who is my vet, those kinds of things. This is what I like. This is what I don't like, not just what you're allergic to. People always say, well, they're allergic to this and this and this. Right. But what things do you like? Your family or you can fill out your planner. And if you're going to go for a scheduled, let's say, hip surgery, and you're going from there to rehab and then back home where someone's coming in to care for you, this can go with you every step of the way. And you don't have to keep repeating yourself what you like, what you don't like. It's all right here in your planner. And the good thing about it is there is plenty of room. So if you change hairdressers, you change vets, you change anything, there is room to make the change without having to get a new planner. So I would say consider getting the Living Legacy Planner. This is available on Amazon. And if you don't get this one, please consider getting one. As a caregiver, it is very helpful to have information about your client that the family members may not even know. Their family members may be living out of town. And if something happens, they call someone, can you go in and check on my aunt? Can you go in and check on my mom? And they get there and they don't know anything about them. But if you have something like this, they can pick this up and they can see the likes, the dislikes, the needs, and the wants of the person that they are there to care for. So consider getting the Living Legacy Planner. In the meantime, if you're not getting one for someone else, consider getting one for yourself. I have one for myself, so if something happens and I am temporarily down, someone in my family or someone coming in to care for me will know my needs and my wants. Please keep that in mind as so many people these days are having strokes and they are temporarily unable to speak for themselves and unable to use their voice. Please be mindful of the signs of a stroke and know that they require immediate attention. Don't delay, don't think about it. Act fast, think about it later. Act right away. So please keep that in mind. Please look at those around you. Look at how their walk is, how their balance is, how their speech is. Consider if you think they need to see someone if something is going on with them. So, thank you for watching today. I hope you will keep this information in mind. And I look forward to seeing you next time, right here on Senior and Living Today.